Today's medical world is ever-changing, with new achievements made daily. Information is the patient's best ally to ensure that the very best care is delivered.
The benefit of this program is that it's based on science. Medical science drives quality care. The goal is to provide an independent evaluation of your medical problem by an expert in the particular area of involvement. When you have concerns about your diagnosis, your prognosis, or what treatment options are available to you, that is the time you need a second opinion. The expert medical opinion will allow you to pursue additional evaluation or additional treatment, or it may delay or forestall or stop unnecessary treatment. This program is built on the basis of teamwork. It provides checks and balances of all the medical information that impacts your care. By a consensus opinion, you will wind up with the very best medical care available to you.
Here's how the program works.
We can offer you a number of options.
When a patient calls Advance Medical, they get enrolled and begin working with a physician case manager.
Thank you for calling Advanced Medical. This is Michelle. How can I help you?
A physician case manager is a qualified, actively practicing doctor. He or she is an advocate and an ongoing resource for patients. The relationship between the patient and the physician case manager begins with a complete medical interview. It determines what the patient is trying to learn and how Advanced Medical can be of the most assistance. With the patient's permission, the physician case manager recruits help from the patient's treating physicians and explains the program. Meanwhile, Advanced Medical gathers all available medical records, images, and any pathological tissue. Advanced Medical forms a clinical committee made up by physician case managers and medical directors. They review the patient's medical records and determine the right experts for the case. These experts review all of the clinical material and write opinions of the best way to proceed. Experts specifically address the patient's questions. The physician case manager then discusses the report with the patient and, if they choose, with the patient's treating physicians. Now, with the best information in hand, the patient can choose the right path forward.
As a case manager, my job is really to be an advocate for the patient. When you've taken all these painkillers, it kind of obscures the nature of the problem a little bit. These are individuals who are bringing really deep-seated problems to the service, looking for answers. They've often encountered a lot of frustration with their local care providers. As a case manager, if I can help connect these patients with the experts that are available, our goal is really to sort of improve the care, clear up murky areas, oftentimes reverse diagnoses or go into new directions that hadn't been considered. So there's a lot of value that we're trying to add.
Advanced Medical's experts are internationally acclaimed for successfully diagnosing and treating specific diseases. They are chosen based on their reputation in the medical community and their prestigious standing at reference medical centers around the world.
As a consulting physician, I review complex cases for Advanced Medical, and I believe it's always valuable to get a fresh set of eyes on any complex case. Have you had multiple different opinions from different physicians? Is there a way you can balance different opinions? An expert medical opinion can not only provide reassurance, but it can limit the number of additional physicians you need to see. I personally recommend second opinions for all complex cases.
Medical issues that can impact your life are critical for you and your family, and therefore you owe it to yourself to make sure you have the best experts available reviewing your case for your well-being.